Hello beautiful people, you are live on a brand new episode of Ladyz Digest where issues in the world of women are discussed. And Ladyz Digest is proudly powered by AAU TV, the voice of higher education in Africa. Pregnant women may experience certain complications and symptoms as the fetus grows, ranging from anemia, urinary tract infection, high blood pressure, which increases the risk of preterm delivery, and this occurs due to a premature rupture of membranes. Premature rupture of membranes, which in this discussion we'll be referring to as PROM, occurs in about 8 to 10% of all pregnancies. PROM before 37 weeks accounts for 1/4 to 1/3 of all preterm births. When we return, we'll digest the topic premature rupture of membranes. Do stay tuned. Welcome back. So our first concern with regards to this topic would be what is premature rupture of membranes? PROM is a rupture or breaking open of the membranes, which is the amniotic sac, before labor begins. If PROM occurs before 37 weeks of pregnancy, it is called preterm premature rupture of membranes, which has the extra P, PPROM, PROM. So what are some of the risk factors associated with the PROM? Preterm labor can affect any pregnancy. Many factors have been associated with an increased risk of preterm labor, including previous preterm labor or premature birth, particularly in the most recent pregnancy or in more than one or previous pregnancies. Pregnancy with twins, triplets, or other multiple births. Shortened cervix, problems with the uterus or placenta, smoking cigarettes or using illicit drugs, vaginal bleeding during pregnancy, and finally, age of the mother, both young and older. So what are some of the causes of this premature rupture of membranes? Rupture of membranes near the end of the pregnancy may be caused by a natural weakening of the membranes or from the force of contractions. Other factors that may be linked to PROM include the following: low socioeconomic conditions, as women in lower socioeconomic conditions are less likely to receive proper prenatal care. We also have the sexually transmitted infections such as the chlamydia and the gonorrhea, previous preterm birth, vaginal bleeding, cigarette smoking during pregnancy, and other unknown causes. So we ask ourselves, why should premature rupture of membranes be of concern? PROM is a complicating factor in as many as 1/3 of premature births. And a significant risk of the PROM is that the baby is very likely to be born within a few days of the membrane rupture. Another major risk of PROM is the development of a serious infection of the placental tissues called chorioamnionitis, which can be very dangerous to mother and baby. Other complications that may occur with PROM include placental abruption, which is the early detachment of the placenta from the uterus. We also have the compression of the umbilical cord, cesarean birth, and postpartum, that is the after delivery infection. So what are some of the symptoms of this PROM? The following are the most common symptoms of PROM. However, each woman may experience symptoms differently. So some of the symptoms are a leaking or a gush of watery fluid from the vagina and a constant wetness in your underwear. If you notice any symptoms of PROM, be sure to call your doctor as soon as possible. The symptoms of PROM may also resemble other medical conditions, so consult your doctor for a diagnosis. So how is the PROM, the premature rupture of membranes, diagnosed? PROM may be diagnosed in several ways, including the following. An examination of the cervix, and this may show the fluid leaking from the cervical opening. There can also be a testing of the pH, which is the acidity or the alkaline of the fluid. They can also look at the dried fluid under a microscope, and this may show a characteristic fan-like pattern, and also ultrasound. So let's get to know how long a pregnancy can stay with ruptured membranes. Research shows that the majority of women with a PPROM will give birth within 1 week of membrane rupture. So let's dive to the management and treatment of the premature rupture of membranes. Treatment for premature rupture of membranes may include hospitalization, monitoring of signs of infection such as fever, pain, increased fetal heart rate, and or laboratory tests, giving the mother medications. Women with a PPROM usually deliver at 34 weeks if stable. If there are signs of abruption, chorioamnionitis, or fetal compromise, then early delivery would be very necessary. And it is worthy to note at this point that specific treatments for PROM will be determined by your doctor based on your pregnancy or overall health and medical history, the extent of your condition, your tolerance for specific medications, procedures, or therapies, and finally, your opinion or your preference. So finally, we'll look at the prevention of the PROM. As the saying goes, prevention is better than cure. Unfortunately, there is no way to actively prevent the PROM. However, this condition does have a strong link with cigarette smoking. So if as a mother or an expectant mother, you quit smoking as soon as possible, it may go a long way in, if not stopping, reducing or narrowing the tendency of its occurrence. Note that almost all pregnancies can end on a good note if you are well taken care of during your journey. This has been Ladyz Digest, and I've been your host, Johnny Kuya Iyoha. Many thanks to my production team for making this production a success. Till I come your way next time. Bye.